Okay, I think we are good to go. Apologize for the slight delay. Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, as usual, our speakers are joining the briefing virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from Mayor Kenny. Mayor, you have.
Thank you, Mike, and good afternoon to everyone. Today, I'm pleased to announce a new citywide marketing campaign to remind people to wear face masks in public. The campaign, called Mask Up, is designed to mobilize all residents, workers, and visitors to adhere to the now mandatory requirement of wearing face masks in public. This week, the campaign will begin reaching target audiences via digital ads and exterior SEPTA bus boards. And Dr. Farley will share more about some of the other placements and uses that are coming this summer. We know that the majority of Philadelphians understand that mask use is critical to stopping the spread of COVID-19. In fact, according to a recent survey, approximately 3/4 of Philadelphians polled believe everyone in Philadelphia needs to wear a mask every time they leave the house. But with mixed messaging at the federal level, we know that out of 4 Philadelphians are still on the fence or opposed to wearing masks. Let me repeat that. 1 out of 4 residents is either uncertain or opposed to using masks. I urge these folks to get with the program and wear a mask. It will protect your neighbors, just as they are protecting you with their masks. So as COVID-19 cases continue to rise across the nation and region, we really want to take aggressive action to motivate the proper continual use of masks by anyone out in public. This campaign aims to normalize mask use for everyone. We'll keep our case counts down by educating Philadelphians on why wearing a mask is more important than ever right now and inspiring them to do their part. I want to thank Dr. Farley and his hardworking staff at the Philadelphia Department of Health for their leadership on this effort. And I want to thank those residents and visitors who are strictly adhering to the mask order. As you go about your day, keep your eyes out for these important messages. And remember, as the campaign says, the best way to love your neighbor is to wear a mask. It also says that Philly never backs down, so mask up. Philadelphians have done an incredible job flattening the curve and helping our economy start to reopen. Mask use is critical to continuing to reopen and resuming a sense of normalcy in our lives. I now turn this over to Dr. Farley for today's COVID update.
All right, good afternoon.
Dr. Farley, your screen is off. Good.
Is that still off?
I can see it.
You're good. You're good. Yeah, you're good.
I can see him.
All right, sorry about that. So case counts from the coronavirus continue to rise nationally and in Pennsylvania. Now here in Philadelphia, our daily case counts over the past week have been stable or increasing slightly. So here are the numbers. Since this time yesterday, we've identified 159 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 27,228 since the beginning of the epidemic. Now, in the past week, we're averaging about 115 cases per day. If you want to get a sense for the overall trends, because it does change a lot from day to day, I suggest you look at the graph on our website. And we did have a large number of tests reported since yesterday, and of those people who were tested, about 5 to 6% tested positive. That percentage is another number we're looking at to monitor the epidemic, and the number's been stable over the past couple of weeks. Since this time yesterday, we've identified 2 additional deaths from the coronavirus infection, bringing us to a total of 1,627 since the beginning of the epidemic. Now, in other areas of the country, they're seeing continued rapid growth of the epidemic. It's particularly true in Florida and Arizona and in Texas. Now, initially, those sites could say that they were seeing an increase in cases, but not an increase in deaths. But we know that deaths lag behind cases, and that's no longer true. They're seeing increasing deaths in those states, and we're now seeing increases in the daily count of deaths across the nation as a whole. Now, Philadelphia has not seen those rapid increases or those increases in deaths yet, and we very much want to keep it that way. So to prevent us from having similar increases here without shutting down, what we need is high levels of compliance with our safe mode guidance, our safe mode precautions. There's 8 elements to that. Included in them is distancing, keeping 6 feet from other people, reducing crowds. So that's the reason behind us recommending that people continue to work from home if they can, and that people avoid social events. We know that a lot of the spread around the country is occurring in social events. But those guidelines occur especially especially important is the use of masks. Let me talk about why. Remember that people can have this virus and can spread it even if they have no symptoms. The virus spreads when people talk or sneeze or cough, and they put out droplets when they do that. What the mask does is it catches those droplets, and so doing, it protects the people around you. We need everyone to use those when they're around other people. Now, we did observations in late June here in Philadelphia. We found that 55% of Philadelphia residents were using masks at SEPTA stations, and in people who were exiting retail stores, the number was 78%. Now, that's good. That's the majority of Philadelphia residents following our recommendations. But it's not 100%. And to avoid a second wave, we need to do better than that. So we need to make masks the new normal. And that's the thinking behind the media campaign that we're launching today. What the campaign does is it serves as a constant reminder to people to wear a mask and also reminds them why they should. And as the mayor said, there are two messages. The first message is around us, is for us, particularly here in Philadelphia, that despite our differences, despite our opinions, we in Philadelphia do care for each other. And that wearing a mask is a sign that you care about the people around you. It's a sign of respect for others. You may have the infection and not know it. And if you care about others, you don't want to spread the infection to them, and so you wear a mask. So we're the city of brotherly and sisterly love. So that's why the campaign slogan is, as you see over my right shoulder here, love your neighbor, wear a mask. Now that's one image I'm showing you here. Now I'm going to try to share my screen so I can show you more of these images. Just hang on 1 minute.
There we go. That's great.
All right, hold on one sec. Okay, so that's one image behind me. There's another image there. They're going to be different people of different racial groups and genders in this campaign. And the second message is also ties in us as Philadelphia residents. People of Philadelphia are tough. No one in the city has ever had it easy. But we find ways to fight through tough times. And sure enough, these are tough times now. And masks are what we have to do to fight through them. So the second slogan is, Philly never backs down, mask up. Now, I've done a lot of media campaigns over the years, and the best ones do two things. First, they tell viewers exactly what they should do. And second of all, they show them doing what they should do. And so that's why these images look like as they do. They show people wearing masks. There's no mistaking what the message is here. Now, because we need to reach everyone, as I said, we're going to have images of showing men and women, people, all race and ethnic groups, and it's going to be in different languages. So here's one in Spanish, and here's one in Chinese. And the images are going to be in many different locations, especially where the viewers should be wearing masks. So you're going to see them on buses like this, these big, as you see on the side of buses. Here's one of already. Others are going to look like this. One here, and this one here. You'll also see floor decals like this, and there will be in other locations outdoors. We'll also be doing digital ads on social media. We'll be doing newspaper ads, including community papers and radio stations. And we'll be distributing posters and flyers through grassroots outreach. And we're going to continue to remind people at every opportunity. Then we're going to evaluate this campaign, and we're going to continue to monitor mask use, as I've showed you, following up with the numbers that I showed you here. So that's our campaign. And if you want more information about the epidemic, go to www.phila.gov/COVID. I'll be happy to answer any questions later. Let me unshare my screen here.
Very good. Thank you. Dr. Farley, did you have more comments, or
nope, that's it.
Wrapped up there? Very, very good. Thank you. And now we will go to Armando for the Spanish language translations of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para el jueves 9 de julio del 2020. Buenas tardes. Hoy me complace anunciar que una nueva campaña de mercadeo en toda la ciudad para recordarle a las personas que deben usar correctamente las máscaras o cubiertas faciales en público. La campaña, llamada Usa tu máscara, está diseñada para movilizar a todos los residentes, trabajadores y visitantes para cumplir con el uso obligatorio de las máscaras en público. Esta semana, la campaña se desplegará a través de anuncios digitales y rotulados de gran tamaño en los autobuses de SEPTA. Sabemos que la mayoría de los habitantes de Filadelfia entienden que el uso de las máscaras es fundamental para detener la propagación del COVID-19. De hecho, según un reciente sondeo, aproximadamente 3/4 partes de los encuestados creen que todos en Filadelfia deben usar las máscaras al salir de casa. Pero con los mensajes mixtos que se han emitido a nivel federal, sabemos que 1 de cada 4 habitantes de Filadelfia todavía se resiste a usar máscaras. Y vale la pena repetirlo. 1 de cada 4 residentes se opone al uso de las mascarillas. Les ruego encarecidamente a estas personas a que se sumen al programa y usen una máscara. Esto protegerá a sus vecinos del mismo modo que cuando ellos los protegen a ustedes al usar sus máscaras. A medida que los casos del COVID-19 continúan aumentando en todo el país y en nuestra región, queremos adoptar medidas agresivas para motivar el uso adecuado y continuo de máscaras por parte de cualquier persona en público. Esta campaña tiene como objetivo normalizar el uso de mascarillas para todos. Y continuaremos educando a los habitantes de Filadelfia sobre el por qué usar una máscara es más importante que nunca en este momento, buscando motivarlos para que hagan su parte. Quiero agradecerle al Dr. Farley y a su equipo del Departamento de Salud de Filadelfia por liderar este esfuerzo. Quiero también agradecerles a los residentes y visitantes que cumplen estrictamente con la orden de usar máscaras. Recuerde que, como dice la campaña, la mejor manera de querer a su vecino es poniéndose una mascarilla. La campaña también dice que Philly nunca retrocede, así que todos debemos utilizar nuestro tapabocas. Los habitantes de Filadelfia han hecho un trabajo increíble para aplanar la curva, ayudando a la reapertura de nuestra economía. Por lo tanto, el uso de las mascarillas es crítico para continuar reabriendo nuestra ciudad y así recobrar un sentido de normalidad en nuestras vidas. De manera que el llamado es uno solo: usa tu máscara. Y esta es la actualización en materia de salud para el día jueves 9 de julio del 2020. Los casos continúan aumentando a nivel nacional y también en Pensilvania. En Filadelfia, el reporte de casos se encuentra relativamente estable desde la semana pasada. Se han reportado 159 nuevos casos con un total de 26.091 casos acumulados. En promedio, hemos tenido 115 casos diarios durante la última semana. Los invitamos a revisar nuestro sitio web para ver el gráfico de las tendencias. Hay un 5 a 6% del total de pruebas realizadas que han dado resultados positivos. Y hoy, lamentablemente, reportamos 2 nuevos fallecimientos por la COVID-19 en Filadelfia. El total acumulado de muertes por la COVID-19 es de 1.627 personas. En los Estados Unidos, los casos se están incrementando rápidamente, particularmente en Florida, Arizona y Texas. Inicialmente, en esta segunda ola, no se reportaron tantas muertes, pero debido al retraso en el cruce con las bases de datos, estos números se están incrementando. Aquí, todavía no hemos visto un rápido aumento de los casos, pero para prevenir una situación similar a la de los estados antes mencionados, sin tener que suspender totalmente las operaciones comerciales, tenemos que demostrar un alto nivel de cumplimiento con las precauciones de seguridad. Y esto se logra mediante el mantener la distancia social y con respecto al control de multitudes. Emitimos la recomendación a todas las personas que puedan trabajar desde casa que continúen haciéndolo. Otra recomendación importante es que las personas eviten los eventos sociales, la instalación de barreras de plexiglas en los comercios, pero muy especialmente el uso de las mascarillas en lugares públicos. Recuerde que el virus se propaga a través de las secreciones expulsadas al toser, estornudar o incluso al hablar. Las mascarillas atrapan estas secreciones y protegen a las personas que están a su alrededor. Todos deben usar las máscaras cuando estén alrededor de otras personas. En las estaciones de SEPTA, del 13 al 24 de junio, solo un 55% de los usuarios llevaban mascarillas, en contraste con un 78% que las usaban correctamente al ingresar en una tienda. Necesitamos hacerlo mejor para evitar una segunda ola de contagios. Necesitamos hacer del uso de la mascarilla parte de nuestra nueva normalidad. La campaña Usa tu máscara tiene como objetivo subrayar la importancia del uso de la mascarilla y contiene 2 mensajes. El primero es que a pesar de nuestras diferencias y diversas opiniones, a nosotros nos preocupa el prójimo. Utilizar una máscara es sinónimo de que te importa tu vecino, ya que probablemente puedas estar infectado y aún no lo sabes. Si te importan las otras personas y no quieres propagar la infección, debes usar una mascarilla. Filadelfia es la ciudad del amor fraternal y el cariño sororal. Por lo tanto, el primer mensaje clave es: quiere a tu vecino, usa tu máscara. En cuanto al segundo mensaje, sabemos que la gente de Filadelfia es perseverante y siempre busca la forma de reclamar sus derechos y pelear por lo justo. Y estos son momentos difíciles. Pero el usar una máscara es una acción que debemos tomar para pelear contra el virus. Por eso, nuestro segundo mensaje es: Philly nunca se rinde, usa tu máscara. El Dr. Farley ha realizado muchas campañas de salud pública a lo largo de los años. Y esto es lo que se ha aprendido. 1. Hay que decirle claramente a las personas lo que deben hacer. Y 2. Hay que mostrarle a las personas con imágenes o gráficos lo que deben hacer para evitar malas interpretaciones. El mensaje en nuestra campaña es claro y no hay posibilidad de error. El mensaje es uno solo: usa tu máscara. Necesitamos alcanzar a toda la población en la ciudad. Las imágenes desplegadas muestran a hombres y mujeres de todas las razas y grupos étnicos. La campaña también se está difundiendo en varios idiomas: en inglés, en español y en chino simplificado. Las imágenes están ubicadas en diferentes lugares donde se espera que las personas utilicen su mascarilla, tales como autobuses, ubicaciones al aire libre y etiquetas en los pisos de lugares que tienen alto tráfico de personas. Igualmente, se realizó una inversión en publicidad digital, en radio y en publicidad de empresa en los periódicos comunitarios. Se van a distribuir afiches y volantes directamente en las comunidades. Y nosotros continuaremos recordándole a las personas sobre el uso de la máscara en cada oportunidad que tengamos. Asimismo, vamos a estar monitoreando cercanamente el uso de la máscara. Estaremos viviendo con este virus por un largo tiempo, pero no será para siempre. Eso es lo que esperamos y sabemos que solo con nuestro esfuerzo conjunto podremos superar esta crisis. Quiere a tus vecinos, usa tu máscara. Gracias.
Thank you, Armando. And we are now going to move to the Q&A portion for members of the media. As usual, please limit your questions to topics related to the COVID-19 pandemic. If your hand is raised now and you were about to ask on a different topic, please lower it and we will try to get to it later. And remember, of course, we have limited time, so only one representative from each media outlet is permitted to ask questions. And please limit your questions to 3 or fewer. For now, let's start off with Mitch Blocker of NBC 10.
Thank you. Good afternoon. I have a couple of questions for Dr. Farley, and I was wondering, Armando, if you wouldn't mind translating the answers for my colleagues at Telemundo. The first question, Dr. Farley, is doctors and nurses in Philly are telling us that they're running low on gloves now, as well as the N95 masks, and they say that the test results that they're submitting are taking a week or longer, which leaves people unaware if they're positive and infecting others. I'm curious, are the city testing sites also experiencing a PPE shortage and a delay in results?
So we're not experiencing a PPE shortage at the testing sites. Now, most of the sites are not operated by the city, but the testing sites that we're aware of.
Sir, will you turn your camera on?
I'm sorry, I had it on a minute ago.
Yeah.
There you go.
Are we on now? All right.
Yeah, we're
My
good.
apologies. We are not experiencing a shortage of PPE at our testing sites. And we're looking at our data, and for the testing that we're sending in, we're not seeing delays in the testing. I am concerned about the future, though. I certainly have heard in other parts of the country that they are having long delays in getting their and bottlenecks at testing sites because there's so many people who want to be tested, and that they're having difficult shortages of PPE in other parts of the country. So it may be that this will happen here in the future, but we're not seeing it yet.
You would like the interpretation now?
Yes.
Yes, if you don't mind. Is that easier for you?
Yes.
Con la falta de equipos de protección personal para los lugares donde se están administrando las pruebas, y el doctor Farley nos indica de que no estamos experimentando una falta de equipo de protección personal en los lugares donde se emiten las pruebas. Tampoco nos preocupan los retrasos porque podemos satisfacer las necesidades, pero sí nos importa lo que pueda suceder en el futuro. Y estamos observando que en otras partes del país hay retrasos y hay falta tal vez de equipo de protección personal porque hay muchas más personas y tal vez esto sea algo que tengamos que ver para nosotros en el futuro, pero no todavía.
Gracias, thank you. Dr. Farley, how are the case numbers in the West and the South and their potential need for PPE? Does that play into, do you think, some of the reasons why some of the independent groups, such as the Black Doctors COVID-19 Consortium, might be having difficulty getting gloves and masks?
I mean, it could be. I have just read in the paper of shortages of PPE in the heavy hit part of the country. So it may be that people placing orders now are having some shortages. I can tell you that as of last week, I talked to the hospitals across the city that they were all saying that they were well stocked and did not have trouble. But maybe this is the first sign of that the epidemic in other parts of the country is having some impact on us here. Again, I haven't heard that yet, but I'll continue to look for it.
Armando, did you want to provide translation of that?
I did not take the information for that. Mayor, excuse me, Dr. Farley, can you please repeat? I'm sorry.
Rather than do that, why don't we go to Mish's next question, and then Yaima will go to you next.
All right.
Okay. My last question for you, Dr. Farley, is if the rest of the country's spike is having some sort of ripple effect in potentially our ability to get supplies or to provide tests quickly, what does that mean for the pandemic going forward in Philadelphia and in our region?
Well, we have talked to the hospitals about stockpiling supplies so they can be prepared for a surge of patients, or in this case, maybe shortage of supplies. There are other ways to conserve PPE. We have the ability now to have masks be sterilized through a process using hydrogen peroxide. So I do think there are ways that we can deal with this. We certainly would prefer not to. We prefer to not have any shortages at all. But we managed to work our way through shortages when we had our peak back in April. I think we could as well in the future. I wish we didn't have it, but we do have things we can do.
Thank you, sir.
La pregunta tiene que ver con la posibilidad de que falten los suministros, y ya que el resto del país está experimentando un punte en las infecciones, y puede haber algo que venga acá a Filadelfia de la misma manera en cuanto a los suministros y que no haya suficiente para administrarse rápidamente. ¿Y qué vamos a hacer con la pandemia si esto sucede en nuestra región y en Filadelfia? Y el doctor Farley responde de que se han estado pidiendo a los proveedores de servicios de salud que guarden suministros, equipos de protección personal, y que si hay más pacientes, hay maneras de conservar los equipos de protección personal, hay maneras de esterilizar este equipo con el hidróxido de carbono, es decir, el agua oxigenada, que no estamos experimentando en estos momentos una falta de equipo. Vimos este ejemplo con lo que pasó en el repunte del mes de abril y creo que podemos superar esta causa si se viniera para aquí.
Thank you, Armando and Dr. Farley. Aima, did you need anything further?
Yes, I do. I just have I have two questions on a different topic.
Go ahead.
Okay, mi pregunta es sobre las mascarillas. Si uno de cada 4 personas no está usando esta máscara para protegerse y están lanzando esta campaña, ¿no sería también mejor multar a las personas que no la usan?
I have two questions. The first question has to deal with the use of the masks in public. If 1 out of 4 people are not wearing them in order to protect themselves and their neighbors, and there you have this that's been launched, are you considering having fines as part of it in order to induce people to do the right thing? Aima, esta pregunta es para el alcalde, ¿verdad?
Sí, o para Farley, quien sea que la pueda contestar.
Armando, I didn't get the end of your translation.
The question is if they show that 1 out of 4 people are not wearing masks to
like 50
their neighbors, and you have launched a campaign to try to expand this use of the masks, are you considering fining people, issuing them fines for not wearing masks?
Not at this point. As we've said on a number of occasions, Enforcement's difficult because of people's human nature. We're hoping the campaign will continue to drive home the efficacy of wearing masks and why it's important to yourself and to your neighbors. We're not at the point of taking people into custody or fining people at this moment.
Como hemos dicho anteriormente y hemos recalcado en este punto anteriormente, es difícil hacer cumplir con esta normativa debido a la naturaleza de los seres humanos, pero tenemos esta campaña en la cual estamos resaltando la eficacia de usar las mascarillas para protegerse a sí mismo y proteger a los vecinos, pero no estamos considerando en estos momentos arrestar a las personas o emitirles multas por no cumplir.
Mi otra pregunta y la última pregunta también es para el alcalde. Se está hablando de que los niños regresen a la escuela el próximo año escolar. Igualmente esto requiere mucho gasto porque se van a tener que tomar otras medidas. ¿Cómo la ciudad, cómo se va a afrontar lo que sería la crisis económica y el gasto que esto va a generar?
My second question is also for Mayor Kenny. This is in regards to conversations and the dialogue that's been taking place about the children returning to school in the fall and the increase in the expenses in order to keep things safe and correct. And how is the city planning to deal with the finances and the financial impact of doing this correctly so that the crisis is controlled?
Well, the planning is still going on. The school district is dealing with both the Board of Education and Dr. Height's office in coming up with the proposed final plan. We will be able to cost it, and we'll have to pay for it like we pay for everything else. Whatever we can get reimbursed on through federal channels, we will pursue, or state channels. We don't know the exact cost yet, but we have to educate our kids, and we'll have to pay for it, and we'll find a way to do it.
Todavía está en las etapas de planificación, el retorno seguro a las escuelas en el otoño, pero nuestro distrito escolar, bajo el liderazgo del Dr. Haidt, está confiriendo con el Departamento de Educación para ver si existen fondos de reembolso que podamos solicitar y recibir a nivel federal y a nivel estatal. No tenemos una idea del costo todavía, pero obviamente queremos regresar a los niños a la escuela, darles una educación y que esto se haga bajo medidas de seguridad. Por nada.
Very good. Thank you. And thank you, Yaima. We'll go now to Victor Fiorello of Philadelphia Magazine.
Hi, good afternoon. Mr. Mayor, you mentioned how hard it is to enforce mask requirements in Philadelphia. It would seem that it's a lot easier to enforce restaurant protocols. And I'm told that the health department had a call last week with some representatives from different restaurant associations, including Restaurant and Lodging, and that they were told that the city was going to stop, just warning people, but shutting down restaurants. My understanding is that there's only been one restaurant shut down since then. I may be wrong about that. And Dr. Farley, if you have other information, I'd love to hear it. But just walking around the city, I'm sure that you've all seen the restaurants where tables and chairs are too close together and that other protocols aren't in place. Do we need more inspectors to go out on the streets to verify that restaurants are following these protocols? What's the problem here? Why aren't we getting these restaurants to comply? Understanding that there are plenty of restaurants that are doing the right thing. There are a lot that aren't, and they're going to jeopardize it for the rest of them.
Doctor, I think you're more.
Yeah, I can take that question, Mayor. So, when the restaurants first started having outdoor dining, I was concerned about that, just having seen with my own eyes some restaurants that were not following the guidelines. Since that time, the ones that I've seen seem to be better. We did last weekend go down, and I believe we shut down 2 restaurants. Our inspectors will continue to go to restaurants, and if they are not following the rules, they will, as appropriate, issue them warnings or shut them down. We can't be in every restaurant every day, but we certainly will be out there enforcing that. So, I'm trying to allow the restaurants to gain an economic footing at the same time that we try to enforce safety. So we're doing the best we can. It's never going to be perfect. I would recommend that you or anyone else who sees a restaurant where you feel that they're not following the rules, call 311 and issue a complaint, and we will absolutely send an inspector out to inspect and issue warnings or shut down as appropriate.
And as a follow-up, thank you to that. Are the inspectors going out just on a roving basis and seeing what they observe, or are the visits that they're making based solely on complaints?
It's a combination. There's a schedule that they go out to specific restaurants and inspect for the full food safety as well. We don't want to have salmonella outbreak throughout this, but they also will go out in response to complaints.
Thank you.
All right, Victor, you're all set. We'll go now to Justine McDaniel of the Philadelphia Inquirer.
Good afternoon. Dr. Farley, New Jersey officials have said they're seeing outbreaks among groups of people who have traveled out of state and returned. Are there any new indications that Philadelphia is seeing any of that from people traveling either like to Pittsburgh area or out of state and coming back?
We definitely have heard of people that got infected. It appears that they were infected through travel. And so we have issued recommendations, as you probably know, that for people who travel to high incidence areas, that they quarantine for 14 days. We did amend that because it became very impractical when Delaware became a high incidence area, say that people can continue to work if they wear a mask at all times for the 14 days afterwards. And we're recommending that people not travel to those high incidence areas.
Thanks. And you mentioned the death rate and that we haven't seen the increases here that other states are now seeing. Can you elaborate just a little? We've had questions from readers who see a lower mortality rate and think that means the threat of the virus is abating. Can you speak to that and whether that's an accurate conclusion to draw?
Yeah. So in other states, the first wave of the second wave, if you want to call that, was among relatively young people. And most of those young people are not going to die from this infection. And so they didn't see that many deaths. But what young people do is then they spread the infection to older people. And then when older people get infected, there may be a fair amount of time between when they first have symptoms and when they ultimately die from it. They may die 3 weeks later on a ventilator in a hospital. So the count of deaths always lags substantially behind the count of new cases. So for a period of time, we saw an increase in cases in Florida and Texas and Arizona, while the number of deaths was declining. And some people were trying to claim that this was not a problem. I was, like all epidemiologists, feeling like this was a problem, that the deaths were just going to come later. And sure enough, there is an increasing number of deaths per day in those high incidence areas. There's an increasing number of deaths per day in the nation as a whole. And I'm sorry to say that that's likely to continue to increase until their case count starts to go down.
Thank you.
Justine, were you all set? You're good?
All set. Thanks.
Okay. Let's go now to Layla Jones of Billy.
Hello. I have a few questions for Dr. Farley. Dr. Farley, the first one is, can you outline the metrics that Philly uses to add states to travel restriction lists?
We're looking at the case count over the past 7 days on a per capita basis. And I forget the actual number. I forget the actual number, but that's the metric, and I can give you more detail on that.
And is that criteria at all also related to that rate of spread or the R0 metric?
No, because this R0 is really impossible to measure. You can only estimate it. And we went with numbers that we could easily count and measure.
Can you clarify, I know you had just mentioned it, but the amendment to that travel restriction list because of the impracticality with Delaware? Right.
So previously we said anybody traveling to a high incidence area should self-quarantine for 14 days after they come back to Philadelphia. Instead, we said they should do that, but if they can't do that, if they have to work, and many people who have to work, then they should be using a mask at all times when they're at work. And in addition to that, if they develop symptoms, stop working right away and get tested.
Thank you.
Layla, are you set?
Yes.
Great, and we will get you that number. We just need to run that by the health department, and we'll get it to you. Next, let's go to Argenis Figueroa of Univision.
Okay, good afternoon, everyone. I have two questions. The first one going to be for Dr. Farley, but I need translation. Armando, por favor.
Ante Argenis, buenas tardes.
Gracias, buenas tardes. Armando, la primera pregunta para el Dr. Farley sería si tiene alguna información de cómo se ha afectado la comunidad hispana de Filadelfia relativo al coronavirus, entendiendo que muchos son trabajadores esenciales y que también viven en condiciones desfavorables.
My first question is to Dr. Farley. I would like to know if you have any information on how coronavirus has affected the Hispanic community in Philadelphia, given that some of them are essential workers and they also have adverse living facilities or living standards.
We certainly have had higher rates of coronavirus mortality and I believe cases in Hispanics than whites in the city, not as high as African Americans. I always worry a little bit about our statistics because I'm not always certain that they're necessarily going to be coded as Hispanic in our data. So I'm concerned. People Hispanic origin often are low income, and low income people are at higher risk. So we want to make sure that the prevention messages go to them as much as possible, especially people who have to work. So we have our safety precautions for businesses, and those safety precautions for businesses should protect the essential workers, including Latinos.
Nosotros hemos tenido tasas más altas de mortalidad y de nuevos casos entre la comunidad hispana en Filadelfia. Ciertamente estas tasas han sido más altas que para los blancos, pero no tan altas como para la comunidad afroamericana. Y nosotros realmente tenemos preocupación por esto, porque hay situaciones en las cuales tienen un menor ingreso y tienen un mayor riesgo. Entonces, lo que nosotros estamos enfocándonos es en la prevención, y para la gente que tiene que salir a trabajar tenemos la protección adicional de que se han emitido normas de seguridad para el trabajo seguro en los ambientes de trabajo, y vamos a continuar reforzando nuestro mensaje para con ellos.
Ok, gracias. La otra pregunta es para el alcalde, y es que hoy vemos en noticias que la ciudad ha renunciado a citaciones contra los protestantes, y quisiera saber del alcalde cómo responde él a aquellos comerciantes que resultaron afectados por los saqueos en esas protestas y pudieran sentir que esta decisión pueda ser injusta.
Una pregunta, Argenis. La primera pregunta tuya, la segunda pregunta, la pregunta para el alcalde. Dijiste que han visto en las noticias que se le está dando a la ciudad citaciones a los protestantes, ¿dices tú?
No. Vimos que el alcalde dice que renunciarán a las citaciones contra los protestantes. ¿Okay?
No les van a emitir citaciones.
No van a emitir citaciones contra los protestantes en el periodo del 30 de mayo al 30 de junio. Pero lo que quisiera explorar con esta pregunta es cómo puede responder él a los comerciantes que han resultado afectados en los saqueos de estas protestas y que pudieran sentir que esta decisión de que no va a haber cargos contra esas personas sientan que está siendo injusta su decisión.
Bien, gracias. This question is Mayor, we have seen news reports that the city is unwilling to charge and issue citations to the protesters from the period of May 30 till June 30th. And my question has to deal with the reaction of the business owners who were affected by the looting during the protests. And how do you explain to them about their feelings that this decision is not necessarily friendly to them, not charging protesters after the looting affected their businesses?
Despite the fact that this is not COVID related, we had made a decision based on the status of the CBNs, which are not criminal charges. Any criminal charges brought by the district attorney for looting or vandalism or anything else has nothing to do with the CBNs. The CBNs are basically tickets that are issued to people for failing to disperse and other minor infractions. They don't rise to the level of property destruction or any kind of assaults or anything like that. And we felt that considering all the strife throughout the entire country and city, that these CBNs most likely were going to be tossed out anyway, sometimes because of the lack of information on the CBNs as we've reviewed them. And it was decided that in a goodwill gesture to all those involved, we would eliminate those CBNs. But anyone charged with vandalism, looting, property destruction, or anything else by the district attorney does not affect them. That's not a free pass for them. This is our more minor issues like failing to disperse and those kinds of charges.
Esto no tiene que ver con la crisis de la coronavirus. Nosotros hemos decidido no tratar de impulsar cargos penales para los tickets o las situaciones que se han dado, pero es distinto considerar los saqueos, la destrucción de la propiedad y las agresiones. Nosotros hemos visto de que estos tickets que se han emitido han sido por no cumplir con dispersarse o abandonar un espacio. Hay una gran diferencia entre eso y la destrucción de la propiedad. Nosotros consideramos de que estas citaciones igualmente iban a ser desechadas, en algunos casos por falta de información. Nosotros estamos de acuerdo con la Fiscalía que sí está presentando cargos serios por destrucción de la propiedad, por vandalismo y por los saqueos, y esos son cargos de orden penal. Nosotros pensamos que fue una medida de buena voluntad el no emitir estos tickets que nuevamente no tienen la misma carga, son solamente por no haber cumplido con una orden de dispersarse y abandonar un espacio. Y vamos a continuar con esto.
Also, CVNs are not criminal charges. They are civil violations, similar to a parking ticket or a trash violation and the like. They do not involve criminal activity. They're civil fines.
Y hay que resaltar, el alcalde lo está diciendo nuevamente, que estas citaciones o estos tickets no son de orden penal, no representan una infracción criminal, sino una infracción civil, por los tickets por el estacionamiento o por infracciones al código de la basura.
Ok, perfecto. Gracias por el aclaratorio.
Thank
Muy
you
amable.
for the clarification.
Thank you, Argenis. Let's go now to Pat Loeb of KYW. Hold on one second, Pat. All right, try unmuting now, Pat.
Okay, thanks. What is the cost of the Wear a Mask campaign?
The total
Good. I'm good, Doc. You got all the details.
the total cost of the campaign is $750,000. That includes development, it includes placement, and a variety of community activities as well as evaluation.
And how long will it continue?
It'll continue till the end of September, so 2.5 months. And some of the ads may stay up after that if they're not, replaced by some other ad.
And I already have a question from a listener who wants to know where they can get a mask like the one shown in the ad. Are they available?
We'll have to get back to you on that. I'm not sure that they are.
Okay. And this does not run afoul. I see you're having them wrapped around buses. It doesn't run afoul of SEPTA's advertising policy where they don't take stands on issues like mask wearing. Nope. Okay.
Nope. SEPTA is happy to run this campaign.
Okay. Thank you.
And the decision on wearing a mask or not should not be a political decision. It's a medical decision. And I think that's the approach.
Okay. Thanks.
All right. Thank you, Pat. Let's go now to Danya Henninger of Billy Penn.
Thank you. This question is for Dr. Farley. You've said repeatedly, you repeated it today, that people who are working remotely, like office workers, should continue to work remotely if possible. I'm sorry, I have music in the background. Let me turn that off. So you've said today, Dr. Farley, that and repeated that remote working office workers should continue to work remotely if possible, considering
Yes.
The situation. But I haven't seen that in a documentation anywhere. The guidance on your site for office workers is the PDFs that I could find are still from, May or when we were in the yellow, which do say work remotely, and that obviously hasn't changed. But I'm hearing from some public safety officers that they need they're asking for written documentation of this.
These are city employees you're talking about?
No. I mean, like at a company, like whoever's in charge of like deciding which office workers come back and how many people come back and who to call back to work.
All right.
When they look for guidance, they see that you were asking people to work remotely when we were in the yellow, but now that we're in this modified green phase, they think it's different. And I know news reports have said, have quoted you, but doesn't hold the same weight.
I understand the question. So we have gone through our guidance for yellow, and where things need to be changed, we updated that in green. I didn't realize we have not gone through and said, this is still true in green. So we will go back over that issue and try to get that clear on our website.
Cool, because the dates on those PDFs are from, last month or months ago.
Correct. But certainly, you can tell everyone that our position has not changed. We considered changing it and decided that we wanted to maintain it in the current modified restricted green.
Yeah, the telling them doesn't do anything, and I've sent sound bites of you, speaking.
So we'll try to get that clear on our website.
Thank you so much. That's it.
Are you all set?
Yep.
Okay, very good. Thank you. Let's go to Rudy Chinchilla of NBC 10.
Hi, everybody. So this question is tangentially related to COVID, so I hope you don't mind me asking it. But what is the city's baseline for declaring a heat health emergency? I know we talked about it last week, but I've been sort of Googling and couldn't quite pin down a hard rubric for the city.
We do have strict criteria for it. I don't have it on the top of my head. We can get it back to you on it. That it has to do with the amount of heat, the heat humidity index, I believe, and also the duration.
Thank you. Yeah, I look forward to that response in that case. This is a question, I don't know, Mike, if I can ask one that's non-coronavirus related.
Yes, why don't you go ahead, because we have one other person waiting to ask questions. So go ahead.
Thank you, appreciate it. So this is for Mayor Kenny. HAPCO has filed a lawsuit against the city, representing landlords, saying that the moratorium on evictions is essentially a violation of contract, and they're saying that landlords are hurting too. First of all, what do you say to that, to the landlords and on that lawsuit? And also, what resources can landlords themselves avail themselves to during this whole situation, which is complicated and evolving for everyone in the city?
I mean, I know this is a very important thing for City Council. It's a city council initiative. Certainly, we don't want to increase the unsheltered population in our city during the course of the medical emergency and of the financial emergency. So having more people housed as possible, city is really what we're trying to do, or what the effort is. City itself has been holding off on water shutoffs and gas shutoffs and the like. So we're contributing to keeping people sheltered and safe. I can get back to you on what the landlords can do. I believe there are a couple programs for them to apply for, but I don't have that in front of me. But the main key takeaway from this is the more people we can keep sheltered during the course of this financial situation and medical situation, I think the better off and healthy we'll be. And at some point in time, as we hopefully pull out of this, we will be able to get back to some sense of normalcy and get everything kind of straightened out with the landlords and with the tenants.
And actually, in that vein, real quickly, would the city consider a suspension on property tax for landlords going forward?
Certainly, what we consider, I don't know, I have an answer for you one way or the other, but certainly it's the consideration. We've done our budget already for the fiscal year, so it may be something that could be visited in the next budget round.
Thank you.
All right, Rudy, if you shoot us an email for that heat index, heat health emergency rubric, we'll get that to you. Press@phila.gov. Let's go now to Martin Pratt at Philly YBN.
Thank you. Quick two questions. First, is there a list of the play streets that have the water, the 100 play streets listed somewhere on the website, or can I get access to that?
I believe they are listed on the website. I don't have that in front of me, but
okay.
Have you looked at the website?
Yes, I have.
You've looked at it and can't find it?
No.
Martin, we'll get that to you. Just shoot us an email and we'll.
Okay, thank you. And the second question is regarding for Dr. Farley. When we look at the symptoms of people who have survived COVID, we're seeing consistent symptoms that they're having. Has the city given any thought to creating some type of treatment protocol that the public can use? And additionally, there has been a lot of talk about mental health for victims of COVID, and they're not finding a lot of places that they can turn to. They're starting their own support groups and stuff like that. Has the city given any thought to that?
Let me say, we're still learning about the coronavirus illness. It's a new virus, and a lot of things we'll learn in the future about the long-term effects of this. That really needs to take place, though, in the medical care system, which the city in general does not operate. We have our own clinics, but we're a small fraction of the overall system. If there's something that, I'll be in contact with my colleagues in healthcare to see if there's anything that they're doing, but I don't see a role for the city in that right now. As far as the mental health, the Department of Behavioral Health provides services for people who have Medicaid, which is close to half of the city's population, and as well as people who are uninsured who have behavioral health problems. a variety of behavioral health services. And so those services are there regardless of the cost, whether you're having mental health problems because you had COVID or you have mental health problems for 20 other reasons. And so I would encourage people who had COVID or having mental health problems to avail themselves of that. And I always forget the number, but there's an 800 number where people can call and get more information.
I just have one last question. Dental, are residents allowed to go to dentists now?
They are.
Thank you.
Okay, thank you, Martin. Finally today, Manny Smith of CBS 3.
All right, a couple of questions from our team today. Probably first one for the mayor. We know that Vice President Pence is on his way to the city. There's a big old FOP event tonight. Any reaction to the Vice President making a campaign-style event in the middle of a pandemic, and any preparations specifically with police and protesters tonight in Northeast?
Both the president and the vice president, standard operating procedure is to have large events in the middle of the pandemic, which doesn't make any sense to anyone. I would think that where the FOP lodge is located is more remote. It's towards the upper end of the city, and it is private property. So I'm sure that there are special events folks are monitoring it and monitoring social media for any type of counter protest. I know when the vice president or president's in play or in a location, there are other security measures from the Secret Service that take over and take over the situation. So I'm sure they have it monitored also. Certainly the vice president or president is free to go wherever they want to campaign, as is former Vice President Biden. But Vice President Biden had been more mature and responsible by basically staying close to home and doing things remotely. We'll hope for the best. I suspect it'll be okay tonight, and we'll see how it goes.
Thank you. My second question, Mayor, is I know we've talked a number of times in this press conference about fireworks and youth, and the past few days have been not a good couple days for kids and that mix. Any reaction?
Well, I remember growing up with my dad as a firefighter. I was told consistently that whenever there were fireworks present was to turn around and go the other way. And I still have that kind of fear of and distance from fireworks in general. I think that what's available to people now is insanely explosive and ridiculous amounts of firepower. I think the state does have the ability to eliminate the availability of these things. They should not be in the hands of anyone other than the professionals. Again, while I understand people's frustration with the noise, and I understand people's concern and upsetment with the poor kids that are kind of blowing off parts of their limbs, the legislature can stop this, and we would hope, with based on what's going on across the state, that they would take some measures to reduce the availability of it or eliminate it. But it is problematic, and we got to continue to educate families. The one poor girl who lost most of her foot was set off with the device was set off inside a house, which is an absolute no-no. And hope she can recover and have some normal life. And young man lost most of his hand. So again, I go back to my training as a child is to train your kids to go the other way when it comes to these incendiary devices.
All right, and my last question is about the Parkway camp. I know you guys have been talking with the organizers. Any updates on? Do you guys come into an agreement?
There will be a finality to it. I understand people's frustrations who live around there and who want to use the athletic fields. We have certain protocols that we have to follow legally. If we attempt to do something without following those requirements, we could wind up in federal court and probably lose. So we're moving judiciously to an end of this at some point soon, but we have to follow all the necessary regulations and protocols in order to do it legally.
All right. Thank you so much.
Thank you, Manny. Thank you, Mayor. And thank you, everyone, for joining us. That is all the time we have for the next press avail will be on Tuesday, July 14th at 1 p.m. Thank you.